Thanks everybody for being here. As Cindy said, I'm a chiropractor and a chiropractic acupuncturist, as well as a chiropractic sports physician. And then I have specialized or have a special interest in animal chiropractic, as well as being a certified rehabilitation practitioner through the University of Tennessee. So I wear a number of hats. I've been in private practice for almost 25 years, and have a multitude of two-legged and four-legged patients.
So if you have any questions or anything, that's my email that you can just contact me on. But I'm really privileged to be here today. So I'm excited to tell you a little bit about my experience with Shockwave and bone healing. So let me introduce you to Gus. This is little Gus. He is now a 3-year-old Yorkshire Terrier. When I met him, well, let's start with his history. So, when he was 6 months old, he fractured his left ulnar and radius. He jumped off a chair, as they do. And he had surgery in April of 2021, and a plate was inserted at the time. And he was kind of weight bearing for a while after surgery, and then he started off weighting quite significantly and favoring that left front. So they took some X-rays. And there was sclerosis of the plate, and the plate was removed on November 9th, 2022 after an X-ray confirmed that it was broken again at the screw insertion. He also has a history of grade 4 medial patellar luxations. Big surprise. His right was worse than his left and was very symptomatic at the time. And he, at his first appointment with me, which was the 19th of December 2022, he had gone through, he was still in a cast on his left front. And they'd also done a luxating patella repair on his right hind leg while he was still non-weight bearing on the left front. So the surgeon's recommendation was to amputate his left forelimb, because they were not winning in their minds. That it had been a year and a half, basically, almost a little longer, and this poor puppy was still not weight bearing, and they were not seeing any results. So they came to me as a Hail Mary, and on recommendation from one of the veterinarians I work with. And so we started Gus's journey. So this was Gus at his first appointment, and you can see he is completely cast all the way up past his elbow towards the point of his shoulder. And that's pretty much how this poor little guy had been living for a very long period of time. He was peg-legging it, if I can call it that, and not fully weight-bearing on that leg. So he was just running around kind of knocking things over and not using that leg at all. As you can imagine, it was incredibly uncomfortable. And he was constantly trying to bite at the bandage. And so he was really having a hard time. So these were the X-rays that we first got with the plate removal, and this is how kind of the state he was in on the day that we saw him. So you can see there are multiple fractures still. The holes from the plate have not filled in, and so he was in pretty tough condition, which is why there was a lot of talk about amputation at the time, particularly because we had 2 incidents and we were not getting bone healing at all, and so there was a lot of concern about bone density loss and just the complete lack of healing that was going on. So after examining him and talking with his team of veterinarians, we decided on a treatment plan, which was to shockwave him once a week for 5 weeks. And the settings we used was a 5 millimeter head, and we used a 5 mil, even though he's such a small chap, to really get into that bone. And we used it on a fairly low intensity of 4 and a frequency of 8, and we were doing between 500 to 800 shocks on the left radius and ulnar per treatment. And on the first treatment, we cast him for a brace, and it was actually one of the smallest braces they'd ever done. And once the brace arrived at about week 3, as it takes a little bit of time to get it back, we started doing some assisted walking in the underwater treadmill. So that was our initial treatment plan. So at follow-up x-rays on February 6th, so this was approximately about 9 weeks after we initiated our plan with Gus. This was the growth that we saw already happening in the bone, which was unbelievable. And everybody was completely and utterly flabbergasted that we had had such great development in such a short period of time. And I firmly believe, because we didn't do any underwater treadmill or any kind of weight bearing for those first initial 3 weeks while we were waiting for the brace to come, I really do believe that it made a huge, huge difference doing the Shockwave over those 5 weeks. So he continued to improve. He was weight bearing. We were doing exercises at home. We were doing exercises in the clinic with him, obviously assisted. And most of the things that we were doing, he was still under certain amounts of restrictions at home, obviously, and he was not allowed to do whatever he wanted. So his owners were very compliant and fully on board. And these were the x-rays that we got April 2023. So you can see it's almost other than the initial fracture, everything else has completely filled in. And at this point, he was sound. So that was just a wonderful development, that we didn't have to lose this little leg, and he's just gone from strength to strength. So in July 2023, this is his last set of x-rays. So let's go back in March. Once the brace was fitted, start a home exercise program. As I said, we started doing things like assisted 3-legged stands and holds, cervical rotation, so cookie stretches, to initiate a little bit of movement onto that hind leg, and then really slow, low cavalettis to encourage weight bearing. That's what we built up to. We were doing some spinal mobilizations with him because he was really misaligned and had some mobility issues because of his non-weight bearing for such a long period of time, and also because of the right MPL. And then in clinic therapeutic exercises, we continued with the underwater treadmill. We started using some resistance bands, some lateral walks, backups, and then Shockwave was continued once a month until July. And this was his last x-ray. So you can see it was the 11th of July, 2023. And that bone growth and healing is just remarkable. So we were really, really pleased. So also just to tell you, he was not in the hero's brace and all the time initially. We kept him pretty well supported up until about April, May, and then he was more in the customized brace after that, once he was fully weight bearing and he was sound. So it was definitely a progression, but I feel like it made a huge, between the Shockwave, the exercise therapy, and the underwater treadmill, I think the x-rays speak for themselves. So this is Gus now. In fact, he was with me a couple of weeks ago. And I'm sorry for the video, because I was taking it as I was doing some stuff with him, so it's not the best video recording, but you can see how beautifully he has done. And we're absolutely ecstatic with his progress. So that's little Gus. Oh, okay. So let's just talk about some mechanisms of action. I've tried to kind of set to the script of what we were given. And Gus's case is not irregular, and it's not uncommon. We've had several dogs that have not been weight bearing or have had surgery, and it's not a complete recovery, that we've used Shockwave on, and with remarkable remarkable transformations, and in a very short period of time. So a lot of people are really scared of using this on things like stress fractures or non-union fractures, but I really encourage you that if you are cautious and you're pretty conservative with it, it can really make a huge difference in your patients' lives. So I wanted to just discuss some of the mechanisms of action. As you all know, because you're all shockwavers probably, is that Shockwave was initially developed for lithotripsy, and we found so many different uses for it over the years as it's progressed. But in orthopedics, it's really made a big difference with non-union fractures, delayed unions, stress fractures, and osteonecrosis. So how does it work? And that's always the question. So one of the biggest things is that with the acoustic waves that Shockwave have, it changes the mechanotransduction of the cells. So it activates osteogenic and angiogenic pathways. So basically, it creates bone growth, and it also creates blood vessels where there was a lack of vascularization previously. And that to me is just such a huge part of the healing, is being able to vascularize an area effectively, increase bone density, help with those healing factors, and obviously have that bone deposition. Increased angiogenesis, and by increasing vascular endothelial growth factors, really that extra bone blood vessel formation where we haven't had any before, just makes the world of difference to speed up that healing. So osteoblastic activity causes the proliferation and the differentiation of bone-forming cells, and that's what Shockwave really helps to promote, as well as increasing endogenous stem cells. So I think that's important too, because stem cells are the building blocks of anything. So if we can stimulate stem cell improvement in the body, that goes a long way to initiate the healing process. It also helps to moderate inflammatory cytokines, which accelerates healing too. So for those of you that were wondering what the mechanism of action is, that's what it is. So clinical applications of Shockwave, delayed union and non-union, like we were talking about, we've had really good cases, and I'll show you some research papers in a little bit. AVN, so with being able to create angiogenesis, the improved vascularization and that bone regeneration in early stages of avascular necrosis is really important. So if we've got a decrease in vascularity going to a bone that could end up with an AVN, being able to stimulate that blood vessel formation at that point in time could really save the leg or save the joint. So stress fractures, and we see a lot. This is a Mally that I treat a lot. She's a little crazy. I love her to bits. She loves Shockwave. It's her favorite modality of them all. And she has a tendency of running around the farm with the horses, and she jumps up and smacks the horse doors. So we've had a couple of stress fractures in her toes. And unfortunately, I don't have a really good picture of her toes here. But it's been literally from one day almost being 3 to 4 out of 5 lame to being sound within 2 to 3 days. And yes, she's a Malinois, so she can embrace the suck, really, because she's pretty hardcore. But it's pretty remarkable. And she unfortunately does it quite a lot. So we've had multiple stress fractures that we've used the Shockwave for, and it's been super efficient. And it just helps to reduce the pain and accelerate healing by the mechanisms that we were talking about earlier. Osteoarthritis and tendinopathies. There is nothing else I use for tendinopathies other than Shockwave generally. Because it just helps so much with that increased vascularization, especially for those bicipital tendinitises that don't want to heal, and those supraspinatus tendons, and just any tendinopathy that you may be dealing with. Shockwave is fantastic because it just changes, it literally starts that healing process really, really quickly. So let's look at some research papers. I've just given you a couple of them. If you want to look them up, I'm sure that this will be available to you. But I wanted to just go through the research a little bit. The 2012 paper from Wang really just goes through exactly what we've talked about. So that extracorporeal shockwave has been helped with non-union fractures, especially in long bones, avascular necrosis of the femoral head, and chronic ulcers, which is really interesting. And I don't know if any of you, and this totally diverts from what I'm talking about now, but there was a really interesting study, and I don't have it here, on that was done with Shockwave and racehorses, and particularly for those that were bleeding. And they found a huge difference once they were using it on them, on the shock. They were using Shockwave on these guys. And it made a huge difference. So it's just super interesting, the research that's coming out right now. So Shaden et al. Also was talking about how effective and safe this is as a treatment option, as far as musculoskeletal disorders go, and all the things that it does, from tissue regeneration to pain reduction, and tendinopathies, delayed bone healing. It's all there. And then Roms did some stuff in 2001, and there is a lot more that has come out. I just took a couple that really went into the delayed bone healing. So if you look back as far as 2001, there was already evidence that there's been amazing changes as far as bone healing goes with extracorporeal shockwave. So you can go through these if you'd like, and there are obviously a lot more. I just didn't want to kind of clutter it up, but you're welcome to read those research studies. So I did kind of add in a little bit at the end of this talk about, for those of you that love really knowing more about things like mechanotransduction and how this all works, and the stimuli that goes and to influence osteogenic and angiogenic pathways. So for those of you that want to know kind of what ion channels and all of that, this is very much for you. So for those of us that are predominantly in clinic and can't remember all these acronyms, this is definitely something that it's great to know and wonderful to read through and very hard to remember. But for those of you that are really kind of into physiology, I just included this for you. So you're welcome to take a read through this if you would like to understand on a physiological basis a little bit more about what's going on. So are there any questions?
Any questions? And Joe is running the chat if you guys don't want to verbalize your question and would rather talk via chat. But questions, ideas, comments? Oh,
Is everybody exhausted and gone to sleep because it was so boring?
Yeah, right.
oh,
No way. Everybody's probably frozen back in their home state, just given how cold it is. But you know what? I did have a question while everyone's maybe kind of
Yeah.
getting all their thoughts together. You've had experience using numerous types of like focus shock waves and radio too, right, Doc?
Mhm.
Maybe could you talk about some of the pros and cons of each one, or when you would apply which one? Not trying to bash anybody else, but just trying to help everybody understand, like, where we sit in the market versus other products out there, and when's the right time to use focus versus radio.
Sure. Well, it's interesting because they've actually found that even radial shockwave can make a big difference on bone healing. So I think really what it comes down to is the intensity that you're using, and really being quite clear about where you are shockwaving. And how much energy you're putting into that area. So what a lot of people struggle to kind of understand is when we started way back when, and I feel like in the human world, we still have this a lot, is like more is better. And that's not really the case anymore. So as we, and mea culpa, when I started using Shockwave, and I'm not going to tell you when I started practicing because it makes me super old, but it was like, we're going to turn this guy up until like literally you almost can't take it, and then we'll just turn it down a smidge and then Shockwave the daylights out of you. So that's really evolved and changed. So I feel like one of the reasons I love my Paizo wave is because it's not invasive, as far as I don't need to sedate the dogs. I don't need to, and not that I would sedate, but I don't need to have them sedated. I can use it really easily on almost any dog without any reactivity. And that's super important. Some of the other units on the market are quite concussive, they're quite noisy, and they're quite invasive, like they're quite painful. And what we've now seen with Shockwave is the energy that you're putting in doesn't have to be excessive to get the results that you're looking for. Heather Owen did a fantastic study about this, and she uses very low energy. And that's kind of where we're going now for those of us that are kind of following the trend of research. So I think units that, one, don't need sedation, and two, that you can adjust the energy to be low in these cases. Like I could never have used some of the units that are on the market on Gus because they would have been way too invasive and they would have hurt him.
Yeah.
And again, like no bashing or anything, but I just don't think we would have got the results that we could have got with some, some units that are more adaptable.
Got it. No, that's great. I appreciate that.
Cool.
So Dr. Weddle has a question about the dose for non-unions, and like you were discussing dose. Did you go a lot higher than that? Well, I think you were at 0.08. And also, what number did you go higher in that dose, and what number of treatments do you typically do, or is it dependent on the radiographic changes?
Great question. Thank you. So I didn't go higher with Gus because we were getting, and one of my big things is I do like, I like pictures. So I was kind of insistent that we followed a radiological diagnostic, if I can say that, to see if we were getting the results. Because obviously the concern was that we had lost so much bone density, and at that point we weren't getting anything filling in at all. So we actually stayed in around 4. Cindy knows that I don't always look at the millijoules and things. I hung around 4, and I used the same head because we were getting such fantastic results. And like I said, so yes, I follow the radiology in answer to your question, because if we weren't getting those results, I would probably have increased my either my intensity, or I would have increased my number of shocks and seen if there was a difference. And I think either way, if it wasn't working, that is a very good approach. I do think that taking into account patient tolerance is incredibly important as well. So I ask for a lot of feedback from the owners as to how sore they were the next day. Are we taking a step forward to take a step backwards is not really our goal. So I always warn people about a healing reaction with their pets. And we can get a healing reaction because we are creating change. So that's something that I think is really important to stress with owners too, is that you can have a 48 to 72 hour window where there may be a little bit of tenderness. We didn't experience that with Gus at all. He just went on an uphill trajectory the entire time. So yes, I based my treatment plans on the diagnostics and the radiographic changes. And I think if you are having If you're not seeing the results that you are expecting in that period of time, you could do either one of those things. Go up in shocks, or you could go a little bit up in intensity if the patient can tolerate it. And so I don't have a hard and fast 5 treatment rule. It really depends on how the dog is reacting and to the treatment. And a lot of the time, we don't have the benefit of having radiology done at such frequent intervals. So we've got to kind of, make an educated guess as to their progression. So I do like following up some Shockwave. Like we no longer do Shockwave with Gus because it's not necessary, obviously. But we did do once a month for a couple of months until we got that radiological clearance. So and really it was just once a month. We didn't kind of do any more or any less. So every patient is different, and I think you have to adjust your plan. That's why I don't tailor make plans in advance, and I don't follow. I'm not that person that has a protocol for everything. So it's very, very patient dependent. But yeah, I think if you're not seeing your results, just keep going at it. And just evolve and adapt is really the thing. And I would, a lot of people are very, very scared of using Shockwave because they're just concerned that they might aggravate it. But the whole point is to almost aggravate it a little bit so that we get the results. So without creating change, we won't get change. And I think that's something that we need to realize as practitioners, is that it can't always be soft and fluffy. You need to create a little bit of an aggravant to get a healing reaction to occur.
I guess one of the questions that always comes up to me with bone healing is, once you get it initiated to a certain extent, and I don't know that we can define the extent, then it keeps running without a whole lot of more treatments.
Mhm.
And how do we know how far is enough to, I mean, I don't know that we do, but
I think it's a thumb suck. Honestly, I think it's an educated guess.
Yep.
And the emphasis is on educated. And also just watching that progression. If you're not seeing any changes after, let's say, 3 weeks of doing Shockwave, and let's say you've done 3 treatments and there's absolutely no change, you may need to evolve your treatment plan. But the reality is that we, like I say, we don't always have the privilege of having diagnostics and everything available to us. So I think just being really observant and increasing your awareness as to the subtleties, because it's not always obvious. Especially in a dog like this, that has been, I mean, he was lame from 6 months old for 18 months, effectively. So, making sure that you are looking for those little nuances, like just a little bit of a change in a gait, monitoring that weight bearing, and watching how they move. I use my camera, I video a lot because I want to be able to compare. And it's not always huge things, it's the small little things that start to happen to be able to evaluate how well that treatment is going and then evolving from there.
And of course you had to follow the compensation of his back and all of that to keep him moving comfortably.
And his knees. I mean, his knees were not awesome. And the fact that he had knee surgery at the same time as it was just a reasonably complicated case. And honestly, I couldn't have asked for it to go better. It was just Lady Luck was completely on our side on that one. And great owners and all the things. And of course, like having the right machinery to make that difference made all the difference. So I think it's really case by case basis too. We had a Labrador came into us, same thing. He had a fracture. He'd been non-weight bearing, well, not non-weight. He was about 3 out of 5 lame. And he had been for months, like 8 or 9 months. And he had been hit by a car It's probably another case study I should have popped in. He'd been hit by a car and he had never fully healed, and he was completely wasted through the forelimb. And I think we did 3 shockwave sessions with him, and he was almost fully load bearing. And then it was just a question of rehabbing him and getting the muscle back. And we haven't seen him in 2 years. So, I mean, we see them, it happens. It's great. And if you also set realistic expectations with your clients, I think, and have these conversations of like, this really can help. I think most people would go for it. So.
Other questions, thoughts, ideas? Anybody else?
Everyone's watching the hockey game.
It's been pretty good recently. I don't watch hockey, but I saw the fights and I was like, all right, it's pretty solid. Well,
Well,
I mean,
if anybody wants to know any other protocols or anything else, you're welcome to reach out.
You're muted, Heather.
yeah, I think you're on mute, Heather.
Yeah, that was a great presentation. Thank you very much.
Yeah, you're welcome.
100%. Yeah, it was awesome.
Cool.
And if you have any questions about treating myofascial trigger points with Shockwave, Dr. Michelle's the one to teach you.
It works like a charm, especially
First she has to teach you to feel them.
Yeah. Well, there's that. No, and then that's the beauty of the Shockwave, honestly. And I know I am like, and yes, this is a Shockwave presentation, but I had a vet with me the other day, and she was like, "What's your favorite machine?" And I was like, "Oh, Shockwave." And she was like, "Really?" And I was like, "Yeah, use it on everything. I love it. It's amazing." Not everything, but obviously. But no, I mean, one of the beauties is that you get a lot of by default, you actually end up treating a ton of the soft tissue. And depending on the size of the dog and the head you're using, or are you using the linear head, are you using the focal head that I know isn't the focal head, but Cindy always laughs at me because I get it wrong. The big one or the little ones. But either way, you're going to affect the tissue around it. So, and especially if you're using your linear head, you really do get a large amount of that tissue. So, and it's got to go through something to get to the bone. So inadvertently, you are doing a lot of tissue work at the same time. And just having the increased vascularization there and the change in mechanotransduction and just fascial movement makes the world of difference. So.
Just because you brought it up, I do have a quick question about that. So, are you changing out gel pads in the middle of a session, or do you
Yes.
kind of just, there you go. All right.
So I do change out. It's kind of I have a little bucket because I move through them so much. So I think what people need to realize, and in Gus's case, it was fairly easy because he was so little, and we didn't have to go to an enormous depth. But I think what people don't think about is that you need, depending on what area of the bone you want to treat, you may need to go deeper in some areas and shallower in others. So if you're trying to hit the subchondral bone, for example, you may have to go with a deeper pad to really get into an area, depending on where you're treating, than doing something on a long bone. So that is something I do, especially when I'm treating things like stifles. I mix it up a lot. Not so much with hips, but if you're doing something like a stifle, depending on the area that I'm going to treat, I use at least 2 different pads.
Do you have any thoughts about whether you would start, deeper into the joint or more shallow if you're trying to impact more of the fascia? Would you start one way versus the other?
With fascia specifically?
Well, if you're treating even for like non-unions, like would you start more shallow or would you go deeper into the actual area that's impacted?
think it really just depends on what you're treating
Hmm.
and where it is and how much soft tissue there is around it and how much scar tissue there is around it. Because I do believe that scar tissue makes a difference. So if you're trying to go through scar tissue, or if you're trying to go through muscle, there is a difference in the level of penetration that you can get. And that's just my experience. That's not like
Yeah.
gospel.
Yeah.
So I think if you're trying to go through scar tissue to get to something, you may have to go a little bit, either increase your intensity a little bit, or you may have to increase your depth a little bit to get to where you're going. But obviously, I love the piezo because I can just do this and know exactly how deep it is. And that's really helpful because, I mean, I'm I'm a very visual person, so I'll literally go like this to the dog and I'll be like, okay, that's right. Um, and I think one needs to be very cautious that we don't go too deep. There is a little bit of a trend of more is more, and I don't think that that's applicable in Shockwave as much, because if you go too deep, you actually almost lose your target area, and that's what people forget. So if you're trying to get to a point, just get to that point. You don't have to go through that bone or through, an entire area, because you're actually going to lose that focal area that you're trying to treat. So, really being fastidious with your depth, I think, is a huge part of being efficient and being successful with Shockwave.
So
Awesome.
Dr. Wendy Hurley's technician, I was working with in Colorado at one point, and we had I think it was like a greyhound, very bony, and we were working on the metatarsals, and even on very low energy, the dog wasn't being very tolerant, so she just went back to the zero pad.
Greyhound? Oh, no ways, never.
Yeah, so we went back to the zero pad for just a couple hundred pulses, then went on to do something else for a few minutes, blah, blah, blah. And when we went back to treat with the 5 to get to the actual area that we needed to get to, the dog was much more tolerant. It was like we got rid of some of that nerve pain in the fascia with the zero pad.
And I think that's a really excellent point, because, again, talking about these non-unions and the amount of scar tissue and the amount of compensation that's going around, and the periostitis that might be going on in that bone, there's a lot of nociception going on at that point, as well as mechanoreceptors being like hyperfiring. So I've done that actually numerous times. So if a dog is not tolerating a treatment, I will kind of pull right back, almost to decrease the amount, work more on a gate control theory, if you will. So almost like negate some of those nociception, that nociceptive activity, and then you can go back in a little bit higher or a little bit deeper and kind of really focus on your treatment, but you've eradicated some of that initial kind of pain receptor response by just affecting the superficial tissue.
Well, it's a prime example of looking at the patient, and like cookie cutter protocols aren't really helpful, because you really do need to look at all the different tissues. And so it's a prime example, of how easy it can be, but you have to pay attention to all the different tissues that you're dealing with and facets of the area or joint.
And the dog itself, because
Yeah, exactly.
that's why I'm giggling about the greyhound, because they're not very tolerant of many things, just by nature. Whippets are a little bit like that too, and chihuahuas. So yes, you've got, and that's why it's really hard to create protocols for this kind of thing, because it's not a one size fits all. And so much in medicine of any kind, veterinary or human, we try to create protocols, and protocols are lovely as guidelines, but you've got to be adaptive. So
Story of my life.
all of us, and
That's true.
yeah.
Well, thank you. Thank you. Any other questions, anybody? Thank you so much for your time, Dr. Michele. It's always fun to
Anytime.
have you. and interesting to learn from. And look forward to our next myofascial course in Tennessee. It's not far away.
It is not. Yep. Yes, ma'am.
It is not.
Will it be warm?
Oh,
No.
probably not. Feels like winter came late this year, so it's
Yeah.
hanging around a little bit.
Yeah.
Awesome, guys. If you have any questions, just shout out. Be more than happy to answer them.
Thank
Great,
you
thank
so
you.
much.
Thanks,
Cool.
Doc.
Take
We
care.
appreciate you.
Have a great
Awesome.
night.
Bye.
Great night.
Bye.
Bye.